Okay, so I want you guys to imagine a country that prides itself on freedoms and liberties. Now, as soon as I say that, you're probably thinking about the United States, am I right?
Mm-hmm.
Of course. So up until recently, the government has been limited in their involvement as far as what we're required to do as citizens. We're required to serve on a jury, if we're called to do that. We're required to register in a draft, if it ever comes to place. We're required to file our taxes. But beyond those things, I mean, our requirements as citizens has been very minimal up until now. So as of recent, the government has decided that it is now mandatory for us to purchase something, and that would be health insurance. Now, I've worked in the medical field for 13 years, and I've dealt with people who are wealthy to people who are homeless, people who have health insurance, people who save up their money for emergency care and don't need health insurance, and people who just can't afford it. I never thought that I would see it come to a point where the government is actually requiring us to purchase health insurance. So, the Affordable Care Act was an act that President Obama signed on March 23, 2010. It does make it mandatory for United States citizens to have health insurance. There are some exceptions to the rule, of course. The exceptions are if you are in a religion that's opposed to health insurance, you do not have to purchase health insurance. If you are an undocumented immigrant, of course, you don't have to have purchasing health insurance. If you're incarcerated, you don't have to purchase health insurance. If you are a member of an Indian tribe, it's not required. And if you have a family income below the levels of filing taxes, so if your individual income is less than $10,000 a year, or if your family income is less than $20,000 a year, you also do not have to purchase health insurance. In those situations, you would most likely qualify for state assistance. Or if you have to pay more than 8% of your income towards health insurance, then you're not required to purchase it as well. So a lot of you guys probably don't fall into those categories, and you're thinking, okay, I have to purchase health insurance. If you have Medicare, Medicaid, TRICARE, a veteran's benefit, a plan offered by your employer, or you purchase your own health insurance, or you have what they call a grandfather plan, which is a plan that was purchased before the health care reform was signed, you do not have to sign up for a new health care plan. Again, most of you maybe have it offered by an employer, maybe not, but a lot of people are now coming to a point where they never had to worry about buying health insurance, and now they do. So there are some pros to the new Affordable Care Act. Preventative care is covered at 100%. So no matter what insurance plan you buy, you go for your annual physical, immunizations, mammograms, all that stuff is covered at 100%. If you had a pre-existing condition and you didn't have health insurance before, a lot of insurance companies could deny you for a pre-existing condition. So if you already had like cancer or diabetes or something like that, an insurance company could deny you coverage for having a pre-existing condition. Now they can't do that. Now everybody gets offered health insurance no matter what. They have a marketplace where you can log on, and insurance companies actually fight for your business. They have different tiers of plans, and basically the less you pay per month, the more you have to pay out of pocket. You will have higher deductibles, higher coinsurance, and higher out-of-pocket maximums. So it means you pay less up front, but if something catastrophic were to happen, or if you had to have emergency care, you'd be paying more out of pocket at that time. So it affects people because, a lot of people who never had to think about buying insurance now have to. It also affects businesses. If you are self-employed and you have anybody who's working for you, you're now required by law to have insurance for them, which is causing a lot of people to think about how many people they can afford to employ. So some people are getting laid off or fired because they just can't afford to have people working in their company. Businesses also may have to pay more for their portion of the insurance, because insurance now has to meet certain criteria with the government, whereas before they could just offer different plans. Now they have requirements, so the businesses can be paying more, which means they could employ less people, or more money could fall on the people who buy their insurance through their employer. I personally, this year, 2013, paid $95 a month for my health insurance, and I work in a hospital, so that's actually pretty good, $95 a month. Next year, for the exact same plan, it's $145 a month. So the coverage is the same, it's just that I have to pay more for that coverage because of all the stuff that's falling down on the companies. They can't afford to do as much for their people. This also affects hospitals. I work in a hospital, and it's been, this act was signed in 2010, so we've known the changes that are coming. But hospitals, basically, the way that they get reimbursed by the government for their care has always been a per service fee, all right? So whatever they do, they get reimbursed a certain rate. As of next year, 2014, hospitals will be reimbursed by how well people do after they're discharged from the hospital. So if somebody was to return within 30 days for the same problem that they were admitted into the hospital with, that hospital is not going to get reimbursed for their care. And so hospitals some of them are deciding to shut down because they know that they're not going to be able to afford to not be reimbursed. A lot of hospitals are functioning off of the money that they get back from the government, especially nonprofit hospitals. So some people think, oh, I get offered insurance by my employer. My rates only went up I heard somebody say, my rate only went up $12 a month. That's not that big of a deal. This doesn't really affect me. But it actually does affect everybody, because if you think about it, you're going to be paying more for your insurance. Your benefits may or may not be as good, but the way that it affects hospitals and businesses, it ends up affecting everybody in the long run. There are penalties now if you don't sign up for health insurance. So this is where it gets a little bit tricky for people. If you decide not to purchase health insurance and you're like, I don't care what they say, I'm not signing up for health insurance, there are penalties and fees for that. So in 2014, if you do not sign up for health insurance by March 31st, 2014, it is a $95 per adult penalty, and if you have children, it's $47.50 per child, or 1% of your family income. In 2015, it's $325 per adult and $162.50 per child, up to $975, or 2% of your family income. And in 2016 and onward, it's $695 per adult, $347.50 per child, up to $2,085 a year, or 2.5% of your family income. And in case any of you are wondering how that breaks down, I crunched some numbers, and for a family with one adult and one child, if the family income is $25,000 a year, in 2014, they would have to pay $250. If the annual income is $35,000 a year, then it would be $350. But in 2015, if it's still one adult and one child, for a $25,000 annual income, it's $500, and for $35,000 income, it's $700. And then in 2016 and onward, it would be, ready for this, one adult, one child, $1,042.50 a year. That is if you refuse to buy insurance and you're making at least that much money. Now, the government says that it's not required if you make less than $20,000 for your family income. So if you have one adult and one child and you make $21,000 a year, the government is saying that it can't exceed 8%. 8% of that is just under $2,000 a year. So you have to think about, if you're only making $21,000 a year, $2,000 for an adult and a child is a lot of money. So that's a good big chunk of it that's taken out. A lot of people have questioned if the Affordable Care Act is constitutional. Some people say it's against the law for you to require U.S. citizens to purchase something and penalize us if we don't purchase it. The government says, and I just want to read this quote by Chief Judge Joel Dabena. He says, "The government's position amounts to an argument that the mere fact of an individual's existence substantially affects interstate commerce, and therefore Congress may regulate them at every point in their lives." So I want you to think about that and what the government's stand is on our lives and what they can control and what they can't control. They're basically saying that they have control over our lives, that they can institute whatever they feel necessary to fix a problem in society. So the biggest thing that we can do as United States citizens is to really pay attention to these issues and not just assume that things don't affect us, that it's somebody else's problem if they have to purchase insurance and I have my own, or if I receive state assistance, this doesn't affect me. It really does affect everybody, and the biggest thing that we can do is to pay attention and to make sure that we vote all the time for our congressmen, our senators, and our president, and that we're paying attention to the things that they want for our country. And that's it.
Thank you.